Once again, I welcome you to this YouTube channel, Secrets of Health TV. And if today happens to be your first time watching us, kindly subscribe to the channel. Do not forget to click onto the notification bell icon, select all, so that we come your way. Anytime we come your way, you will get notified. On this channel, all we do is to recommend herbal medicine. So if you are interested in herbal medicine, you want to be trained as a herbalist, or you want to heal yourself naturally using herbal stuff, trust me, this page is your sure bet. In today's video, we are going to discuss why some of the reasons why our kidneys fails, or we develop kidney diseases. A lot of people are concentrating on the medication, how to treat kidney disease, but we have forgotten to pay attention to what causes the kidney disease in the first place. Because if we are able to prevent the kidney from failing, or from from getting sick, automatically we are not going to even need any medication. But before we go on to that, the kidney has several functions. The kidneys are one of the most essential and the most important human organ, and that is why God in his own wisdom created two kidneys for each and every one of us, whether male or female. Everybody has two kidneys, and this goes to show you how important the kidneys are. One of the main functions of the kidneys is to regulate the potassium level of the body, the amount of potassium you eat. If the kidney doesn't regulate that amount of potassium, the potassium will end up harming you. So the kidney is there to regulate the amount, the level of the potassium. So if you eat potassium food such as, let's say, yam, potatoes, avocado, tomatoes, okay, bananas, plantains, and so on and so forth, if you eat much of them and there are a lot of potassium in your system, it is this kidney that filter out the excess potassium, because the body, there is a limit, there is an amount of potassium the body will need. So when that amount is exceeded, it is the work of the kidney to filter out the remaining potassium. So mostly if your urine is taken to the hospital or to the lab, it will come out that there are so many potassium in your urine, because the kidney is the one regulating it. So that is the first function of the kidney. Another function of the kidney is that it regulates the heartbeat. This is the reason why most people who are having kidney problem or having kidney disease, they hardly breathe, or they hardly have normal heart pressure, because anybody who is battling with kidney disease will automatically suffer from high blood pressure. You understand? Because it is the kidney which regulates the heartbeat. It is the kidney which makes sure that the heart is beating normal. You understand? So most people who always complain of heart pressure, heart palpitation, tachycardia, and so on and so forth, they should go and check their kidneys. If you are someone who always complain of irregular heartbeat or heart palpitation, I will advise you to go to the nearest hospital for a medical checkup. Go and check your kidney. Your kidney might be in trouble. So you need to check that. And then another function of the kidney I would like to draw your attention to is it is responsible for extracting excess nutrients, excess minerals from your system in the form of urea. So you are able to urinate, you are able to filter out things from your system thanks to the what? Thanks to the kidney. And that is why when the kidney is not in good shape, sometimes the person will suffer from edema, swelling of the feet, swelling of the face, swelling of the hands, and so on and so forth. So these are some of the functions of the what? Of the kidneys. Now let's come back to what damages or what causes kidney disease or kidney failure. There are several factors that causes kidney failure. One of the factors are urinary tract infection, UTI. See, UTI is the most dangerous health condition, but most people don't pay much attention to. A lot of the cases, when someone is diagnosed of kidney disease, the first thing that goes into people's mind is that this guy hasn't been eating well. This guy is drinking alcohol. This guy is this guy is that. Because we all know that when you don't eat well, when you are not eating good food, you are eating junk food, you are eating highly processed foods, and so on and so forth, you can develop kidney disease. That is the only cause we all know. Forgetting that UTI can also cause kidney disease. Very serious one for that matter. Now, what is UTI? Urinary tract infection is an infection which is found in the urinary tract. It is a bacteria which is always found in the urinary tract. The urinary tract consists of the kidney itself, and then the what? The ureter, these two tubes that connect from the two kidneys, left and right. It is called ureter. And then this ureter will come and join the what do you call it? The bladder. And then from the bladder there is another tube called urethra. And then from the bladder, in between the bladder, or between the side and side of the ureter, there is another gland called prostate. And then from the urethra all the way to what? To your penis, and then the urine will flow. So these are the urinary tract infection, or this is the urinary tract. Now when bacteria begins to form within the tract and nothing is done about it, these bacteria can develop inside either the bladder, or they can develop within the urethra, or they can develop within the ureter, or they can develop within the kidney itself. You understand? So we call it urinary tract infection. And when this urinary tract infection, or when this infection begins to develop inside the kidney, they destroys both the what? The nephrons and other department of the kidneys. And you ask yourself, what causes urinary tract infection? When the kidney ends up filtering the excess urea, the urine from your body, the urine contains so many information, both good information and bad information. Any disease that is that is in your blood, any disease, whether cancer, whether whether pneumonia, whether diabetes, any form of pathology or disease, any form of virus, any form of bacteria which is in your blood, which is inside your body, you can use your urine to determine it. That is why most of the times when you go to the lab for a diagnosis, for a lab test, they normally request for your urine, because your urine is like your database. So don't play with your urine. Your urine is like a database. The urine speaks about you. You are the urine, and the urine is you. If doctors want to see whether you are sick or not, they can use only your urine to determine it. Whatever disease you are having, your urine can tell it. So your urine is like an information center. It's like a television station which gives information, which gives news about you. That is your urine. So there is something we call urine therapy. Yes, there is a therapy called looping, urine therapy, where you can be drinking your own urine. One day I will make a special teachings about urine therapy. One day I will make a special teachings about what? urine therapy and you probably will understand. So this urine of yours contains both good information and bad information. Now, the good informations are the bacteria, are the viruses, are the unwanted microbes which are in your blood, and with the help of the kidney, your kidneys are bringing them out. Now, what actually causes UTI is this. When you go to urinate, when your bladder becomes full and you go to the washroom to empty your bladder to urinate, you need to be very, very careful, because this is where most people get their UTI. This is where most people develop UTI, and it eventually ends up in what? In kidney disease or kidney failure. When, as a man, especially men, if you go enter the washroom to empty your bladder, because the urine you are bringing out contains both good information and bad information, you need to make sure that the urinary tract is cleared of urine. Don't allow any urine to remain in the tract, whether in the bladder, whether in the ureter, whether in the prostate, whether in the ureter. Make sure all the urine are what? Are cleared from the urinary tract infection. A lot of men, when they enter the washroom, they pee. As soon as the first, batch of the urine, the chunk of the urine, is passed, then they will do, especially the men, then they will wear their pants back. Sometimes, if you are a man and you are watching me and you will be truthful to yourself, if you urinate like that, you realize that the moment you go out from the washroom, you have the feeling, you sense that some of the urine have been dropping inside your pant, your underwear, isn't it? Am I lying? Be truthful to yourself, because at that very moment you haven't emptied your urinary tract. You only emptied your bladder, but you haven't emptied the tract, because the urinary tract doesn't consist only the bladder. The bladder is the one holding the urine. So if you go to the washroom to empty the bladder, make sure that you don't only empty the bladder, but you empty the whole tract. And the tract consists of your penis, your ureter, your what do you call it, your prostate, and then the bladder itself, and then the ureter, and then the kidney itself. So make sure you empty it, because if you don't empty it, there's going to be a stagnation of what? Of urine. Some of the urine will be what? Will be stuck inside your what? Your urinary tract. And like I told you, the urine contains two information, good information and bad information, which is bacteria and good bacteria. So the bad bacteria will remain inside your tract because they are still in the urine, and you haven't emptied the bladder, you haven't emptied the what? The urinary tract. Therefore, these urine are going to stuck in your penis, they are going to stuck in your urinary tract. That is why most of you complain that when you are urinating, you realize that the urine will split into two before it comes back. Sometimes when you are urinating, you feel some sharp pains within your penis. It is because of that infection, because you haven't been emptying your UTI, your urinary tract. Therefore, there is some stagnation of urine, always urine. And when this urine remains there, sometimes it develops bacteria. So there is going to be some sore inside your penis. Some people complain that they normally feel some movement sensation within their penis because of the UTI. So if you don't treat it well, if you don't make sure you urinate and clear all your UTI, at the end of the day, this bacteria, when they finish developing inside your penis, when they finish developing inside your urinary tract, they will end up in your kidneys. So you realize that your kidneys will be affected, will develop an infection, and it is going to cause a whole lot of issues. So one of the biggest reasons or main reasons why most people suffer from UTI is what? is suffer from kidney failure or kidney disease or kidney infection is the UTI, urinary tract infection. Urinary tract infection is different from STI or STD. Sexually transmitted disease is different from urinary tract infection. They are two different things. Mostly urinary tract infections are normally gotten from lack of emptying your bladder or lack of urinating early. And again, some people also keep urine within themselves, especially, and in fact that is the main one which causes kidney failure or kidney disease. If you are feeling to go urinate and due to one or two reasons you are not urinating, meanwhile your bladder is full, this is what happens. The chunk of or half of the urine, the brain will send half of the urine back to the kidney because the bladder is full. When the bladder becomes so full and you are not emptying it, the brain will instruct the bladder to contract, to push back some of the urine back to your kidney, back to where it came from, meaning back to sender. And when the urine get back to sender, because the urine contains so many microbes, good ones and bad ones, then these microbes will begin to, start harming the kidney. So it is important that anytime you are feeling to urinate, go and urinate. And it doesn't only go back into the bladder. Some of the urine, when you are not urinating, some of them also will go affect your bladder, because your prostate, because the prostate is just beneath the bladder. It's just beneath the bladder, and in between the prostate there is your ureter. So if you are not urinating, some of the urine might leak into your prostate, so you get prostate enlargement. And UTI is also one of the main factor or the main reason why a lot of people are battling with prostate enlargement. So I'm advising each and every one of you, especially if you are a man and you are watching me, stop keeping urine within your bladder. Anytime you feel like to go urinate, go. As soon as your bladder is full and your brain gives you the signal, just go and then urinate and come back. And when you go to urinate too, you have to spend some time. Make sure that the urine is, your bladder, your urinary tract is empty. You clear all the urine before you come back. I hope you understand. So these are the main reasons why a lot of people are battling with kidney failure or kidney disease. And not only that, prostate enlargement as well. Any man who keeps urine within himself, the brain is signaling him that go and urinate, go and urinate, go and urinate, and you are not urinating. You say you are keeping it until you are done with what you are doing. You are putting your kidneys and your prostate in danger as a man. So when someone calls me, doctor, I have prostate enlargement, I have prostate disorder, the first thing I will ask the person, what work do you do? You realize that the person the person is someone who sits for a very long time, and the kind of work the person doesn't allow him to to be going to the washroom to urinate, especially drivers. You understand? Especially drivers, especially those drivers who drive Uber in New York. As for Ghana here, Ghana is a free land. It's a free land. So when you are driving, across the length and breadth of Ghana, anywhere you can just park and urinate. Yes, anywhere. In fact, Ghana is the only African country I know, or is the only country I know where you can even urinate at someone's, backyard. Someone's backyard, you can just go and urinate. The most important thing is that nobody sees you, and that is the only thing we check when we go and we are about to urinate. We just check left, right, center, and make sure that no one sees us. Then we urinate. So Ghana, we don't have that problem because everywhere is a urinal. We can urinate virtually everywhere here in Ghana. Unlike the Western world. So those of you who, you know, works as drivers in the Western world, or who are in the Western world, sometimes your case becomes a bit, you know, disturbing, because you cannot urinate everywhere in the diaspora, especially if you are an Uber driver. Because the reason why I'm saying that, most of the people who contact me for prostate enlargement condition or medicine, most of them are drivers, Uber drivers in New York. Most of them, because that is their problem. That is their problem, because you can't find a place to urinate, to empty your bladder. Sometimes you need to, one guy was telling me, sometimes he need to drive about 50 miles before he go to a filling station, a gas station, to go and urinate. But here in Ghana, as soon as you feel like urinating, you can park your car somewhere, open your door, hide behind the door and urinate. Very simple. All right, so that is that. Thank you very much for watching. Like this video, share to your friends and family and people around you. And in case this is your first time watching us, this platform is all about herbal teachings. This plant you can see behind me, I will do a video, a separate video, and then speak to you about how important it is. It is called Sodom apple. That will be in my next, you know, video. And you see this video, yes, if you want to know how important salt water is, you see this video, yes, if you want to know how important salt water is, just click on the video and, you know, watch it yourself. Very, very amazing video. Most of people who get sick and they are taken to the hospital, as soon as you get to the hospital, the first thing they will give you is salt water. That drip that they give you through intravenous, through the drip, it is salt water. You understand? Yes, I've discussed the importance of salt water in that video. So go and check it and then learn about it. Subscribe, like, and leave your comment. I'll see you in my next one. Have a nice day.